Only to mention the organization.
A study conducted by EACC in 2019 indicates that among 73.1% of Kenyans who paid bribes to get government services, 17.5% were looking for health services.
And chairperson of
the survey also listed the Ministry of Health as the second most likely government office to be corrupt at 17.1%, followed by county health departments at 12.1% and 11.1% at the National Health Insurance Fund.
At the tendering stage, there is an aspect of tender initiation, favoritism at 41.7%, bribery at 16.8%, and again conflict of interest at 13.5%.
At the same time, 43.5% of health-related tenders are obtained through corruption. The reasons for bribery to acquire health projects were evaluated as follows. 45.7% indicates that bribes were expected, 26.1% indicates the bribe was forced, another 26.1% indicates voluntary bribery, and 2.2% saw bribes given to speed up services provision.
The EACC is working very hard towards helping the various institutions of government to work on preventive measures against corruption, rather than for us to wait for corruption to happen and then go after the people who have been involved.
Some of the projects that have been affected by corruption are the construction of an outpatient department at Eldas, Wajir County, the construction of the Tulu Magunga dispensary in Migori, and the construction of Kakamega Teaching and Referral Hospital. The facilities were found guilty of incompleteness, not reaching the appropriate level of quality, and unclear use of funds.
If within the report there are specific names of specific officers, I will deal with them. And you have seen that I'm already dealing with some of them.
Health Cabinet Secretary Susan Nakhumicha has to this end admitted that corruption does exist in her ministry.
This report obviously then gives me impetus to deepen the reforms that I have started working on, geared towards an accountable healthcare system in this country.
Nakhumicha has, however, shown immense faith in the EACC investigation that is ongoing in her ministry, promising Kenyans to soon unpack the universal health coverage anew. Ben Kerera, K24, Nairobi.